This podcast is for general, educational, and entertainment purposes only and should not be considered medical, practice management, legal, investment, or other professional advice. No one should act or refrain from acting based on this podcast without obtaining appropriate professional advice.
We want, like Dr. Stern emphasized, screen everyone, and there is no better tool than colonoscopy to directly visualize the inside of one's colon. So clearly there is a need for more options in terms of how you prep for a colonoscopy, and clearly Hygieia Care has a role here.
Welcome to Gastro Broadcast, presented by Gastrologic, your GI-specific group purchasing and business development partner. I am your host, Dr. Naresh Gunaratnam. Today, I'll be talking to Dr. Pradeep Bakal from Ohio Gastroenterology and Liver Institute in Cincinnati, and Dr. William Buddy Stern from Capital Digestive Care in Washington, D.C. As you may know, March is Colorectal Cancer Awareness Month. My colleagues are here to tell me more about an innovative colonoscopy preparation program that their practices are using. Dr. Bakal and Dr. Stern, thank you for joining me on Gastro Broadcast.
Great. Glad to be here.
Thank you.
So, Dr. Bakal, how important is it for a patient to get screened for colorectal cancer?
I think it's extremely important. Colorectal cancer is still probably the third commonest diagnosed cancer and the second most common cause of cancer death. More importantly, there's a trend towards the cancer deaths being the number one cause for people under 50 years of age. Even though there has been a slight reduction in the incidence of colorectal cancer amongst the elderly, primarily because of increased screening, there is a troubling trend towards an increasing incidence of colorectal cancer, especially in people under 50 years of age. So I think it's extremely important that patients be screened for colorectal cancer.
Great. Dr. Stern, what is the industry standard for prepping patients for colonoscopy? Is the traditional prep a barrier in terms of getting more people screened?
A great question. I just want to add on to what Dr. Bakal said. As people may have heard last year, the actor Chadwick Boseman died from colon cancer at age 43. He was diagnosed at age 39. And last summer, the American Cancer Society reduced the recommended screening age from 50 to 45. And one of the impediments why some people say they don't get a colonoscopy is they're concerned about the prep. The traditional prep, actually, when I first started practice, was drinking a gallon of liquid. It has improved since then, and now we split the dose, but it's split between the night before and early in the morning of the procedure. So patients are up a lot of the night running to the bathroom, don't get much sleep, and they complain about it. And some patients have problems just drinking it down. It makes them nauseous and vomit. So there is a need for an alternative prep. And as you may understand, if the colon's not squeaky clean, we can't examine it correctly.
Dr. Bakal, the makers of stool-based tests make a big deal about how bad the prep is for colonoscopy. Can you talk about how Hygieia Care may be an innovation?
Well, and as Dr. Stern stated, we all know that there's a small population of people who are either unwilling or unable to take the prep. So clearly, Hygieia Care with Hygieia Prep is almost a game changer in terms of the availability of one more tool in our toolkit. The patients present about an hour or two prior to the procedure. The prep is performed on the day of the procedure. It's convenient. They don't have to be up all night. And within about 45 minutes to an hour, they're prepared and ready to undergo the procedure. So it's definitely one more tool in our toolkit.
Do you find the quality of the prep is as good as someone who had taken a standard prep?
It's about 97%. The multiple studies have indicated that the satisfaction amongst providers with the quality of the prep is about 97%.
Dr. Stern, your practice recently opened up the Hygieia Care Center. How did you arrive at that decision to bring that into your practice?
Well, I first saw Hygieia Care, Hygieia Prep several years ago at one of the gastroenterology meetings and got interested in it. And we had Capital Digestive Care, or the predominant GI practice in the Washington, D.C. metropolitan area. And people looked to us for innovation and alternatives. And we brought it to our group, and we thought that this would be a good alternative. As Dr. Bakal said, there are a number of patients who either don't want to take the PrEP or don't get a good PrEP with it. And so we decided to go with Hygieia Care, and we're probably the most recently open. We just opened on January 1st of this year.
Dr. Bakal, you've had experience with some people who've had the PrEP. What kind of feedback are you getting from your patients?
I can tell from our own personal experience from our family members having procedures over the years. There's a close family member who underwent Hygieia Care, and she swears that that was the best PrEP that she's had, because the previous experience having to take the PrEP overnight, it was not very pleasant. And so anecdotally, there's numerous instances within family members and outside of that who have been extremely satisfied. And we've looked at surveys very closely over the last, I want to say, a couple of years since we instituted Hygieia Care in our practice. Almost unanimously, the feedback has been that they would do it again when their turn comes up for their next surveillance.
Well, that's outstanding. Can you just talk about how exactly the PrEP is done, more of the mechanics?
Well, the patient arrives, and they are seated in a basin. It's called a basin. It's actually a specialized seat. They lay on that, and a fully trained technician inserts a sterile nozzle into the rectum, and warm tepid water is passed through the colon by gravity. Takes approximately 45 minutes or so, and the water, as it passes through the colon, it loosens up the stool and preps the patient for a colonoscopy. And they're ready to go when the water appears clear as it passes out. When I say passes out, the patient can actually observe the effluent coming out. And when it's clear, they're ready for the procedure.
Oh, that's really great. Dr. Stern, your practice is one of the few Hygieia Care centers in the U.S. Do you think we'll see more widespread adoption in the future?
I do think so. I think that patients are looking for alternatives. As March is Colorectal Cancer Awareness Month, we want everyone to get screened. We know it reduces the incidence of colon cancer and colon polyps when you get screened. And we want to make sure to get away from any hurdles that prevent patients from getting screened. I can tell you that I'm having a colonoscopy in about 3 weeks, and I'm going to use the Hygieia Care PrEP. The other reason that practices may want to adopt it is we also use it, it's called Hygieia Relief, for chronic constipation. So it can be used for other things other than just the colonoscopy PrEP.
Hopefully we can live stream your colonoscopy on Facebook, right?
Like Katie Couric did that. So
That's right.
Chronic constipation is a real good indication,
Yeah.
We're beginning to see, in the beginning, some of us physicians were reluctant to recommend, Hygieia Care or Hygieia PrEP. But slowly we're beginning to realize that, it's not a bad thing. There are people who just can't have a good bowel movement, satisfying bowel movement, and they struggle. Yeah. And that's why they resort to all kinds of colonics and other things. And if this can be done in a clean, supervised setting, I don't think anybody can argue against that.
No, absolutely. I think there is a subset who kind of suffer in silence because it's not something you announce or talk about. But there are a lot of people, I think, if you do this in a very professional way, that it becomes a regular part and improves quality of life and decreases, obviously these people who are, go once a week or once every other week, there are a lot of those people whose lives are miserable, and their social interactions are bad and they're depressed and so forth. So I think these are the indirect benefits I think that we can gain from this.
But Buddy, correct me if I'm wrong. In the DC area, I'm pretty sure there's a lot more people than in Cincinnati who are busy lawyers or elected officials who don't want to waste a whole night drinking the PrEP, going to the bathroom. They might be the ones who might be on a clear liquid diet the night before, come into a Hygieia Care site, get prepped, have the colonoscopy, perhaps, even though we recommend not to, they might even go back to work.
Yep. No, I think so. And, right now, because it's not reimbursed by insurance, you need to have, the type of patients who are willing to pay out of pocket. So we're certainly in that area.
For both of you, can each of you comment, why would any other practice think about getting Hygieia Care into their system? You both of your groups are very innovative. If I was thinking about doing this here on Gastro, what would you tell me to convince me to do this?
Should I take the question first?
Sure.
Well, all of us have experienced this. There is always a small subset of patients who are either, very wary of having to take the PrEP. They have spoken to friends who have not tolerated the PrEP at night. And many of them, especially the elderly, and for some reason, women just can't handle the volume of the PrEP. Even with the split PrEP, half the volume, they still have issues with taking the PrEP. And we want, like Dr. Stern emphasized, screen everyone. And there is no better tool than colonoscopy to directly visualize the inside of one's colon. So clearly there is a need for more options in terms of how you prep for a colonoscopy. And clearly Hygieia Care has a role here. And I do believe that. And it may not apply to 100% of the patients, but a good 16, 20% of the patients that we have seen in our own practice.
I would just add to that, any practice that's interested in looking at it is welcome to come to any one of the 5 centers in the country to personally look at it. We actually sent our chief tech to Austin to get trained. And I think that if someone is interested, they probably should get together. I'm not sure a single or a small group of gastroenterologists are enough to support it. I think you need to either have one large group or have several groups get together. I mean, it is an investment, and at the present time, it's not reimbursed by insurance, but we're hoping as more and more patients get treated with it, that insurance will start reimbursing it also.
That's great. I'd love to have you come back and talk to us after you've had the colonoscopy to get your experiences. I've seen pictures of the contraption, but where is it situated in your practice, and how many people can be done at the same time? Is it one?
We built a separate suite in the building where one of our division. I'm in the division in Rockville. Probably we have the most physicians there, about 20 physicians or providers, physicians and APPs, and it's a separate suite. And there are actually 3 endo centers within the 2 buildings, between the building we're in and the building next door. So we built it to have 4 chairs. We're starting with just 2 because we just started. Mm-hmm. But we hope to get up to 4 chairs. And what do you have in Cincinnati?
We have 5 chairs. And in retrospect, we should have split that amongst 2 different sites. You can have a patient go through this every 2 hours. So if you have 3 chairs, if you're a center or a site where procedures are done 7:30 or 7 a.m. till 3 or 4, whatever time, you can cycle through a lot of patients because, the turnaround is not that much because they have to clean the contraption or the equipment. But if I have to recommend this to someone, I would say start with 3 chairs if you are a 3 or 4 room center. And then if you have more than one site, split it among sites. Even though theoretically patients can have the Hygieia prep done in one site and then travel by car and get the colonoscopy done elsewhere, some patients are very queasy about that. They think that there might be some leakage, even though I'm being told that in practice that doesn't happen. I've had patients who had, I go to 2 different sites who had Hygieia Care at the main site and got the procedure done at the other place. They did not complain. But, mentally thinking about it, you would feel like, hey, if I'm going to get cleaned at a site, I would rather just walk down the hallway and get the procedure done right there. And that is the most convenient aspect of this whole process. I come in, come at 7 o'clock. By 10 o'clock, 10:30, I'm done with everything, prep and the colonoscopy.
We've actually had a fair number of patients. If you're familiar with the DC metro area, Rockville's suburb. And Michael's division, which has an office in Chevy Chase in DC, they've had some of the, and they have endo centers at both places. We've had a number of patients go down there. It's a good half hour to Chevy Chase and maybe 40 minutes to downtown DC, and they didn't complain. They wanted Hygiea care, and they came up to Rockville. And in the Washington area, a lot of people will live in the suburbs and work downtown, so that's not unusual for them. And during COVID, there's a lot less traffic, so it's easier to get downtown. But we've actually had a number of patients do that, travel like that.
Yeah, I think a lot depends on the physicians, how well they are not promoting it, but thinking of it. You got to be thinking of it. Otherwise, you're not going to prescribe a Hygiea care as a prep, because a lot of us see patients and we're not thinking of anything else. We're so dependent on our medical assistants and others to set this up. We don't care how you get it done, kind of thing. But but there is a subset of patients. You walk out of the office, the doctor might suggest a colonoscopy. They're sitting there thinking, oh my God, last time I had to take the prep, I didn't sleep all night, I threw up, I just can't do it anymore.
Yeah.
I had one patient, and this was her third colonoscopy. And after the first two, she says, I'm not doing it unless there's another prep. And she had it, and she says, I'll never go back to the old prep again.
Oh, wow. Well, thank you both for joining us today. It's great to hear how your practices are innovating and moving gastroenterology forward. So we really appreciate the time.
Thank you.
Thank you. And just remember to get screened.
Thank you for listening to the Gastro Broadcast. Find new episodes through Apple, Google, Stitcher, Spotify, or wherever you get your podcast fix. For information about our hosts, guests, and supporters, visit gastrobroadcast.com.
Produced by Steadfast Collab.